Channel. Now we are going to discuss about the popliteal artery. So popliteal artery is nothing but it's a continuation of the femoral artery, where it begins at the opening in the adductor magnus. In the adductor magnus you have some hole like structure that is called as adductor hiatus magnus. That from that hiatus magnus the femoral artery will travel and come backward towards the posterior side of the knee joint to enter the popliteal fossa, and there it converts into the popliteal artery. So the femoral artery only continue as a popliteal artery. So femoral artery, when it is passing to the hiatus magnus, just after passing from the hiatus magnus, is converted into the popliteal artery. So this popliteal artery, that where the hiatus magnus is located, is at the junction of middle 1/3 of lower 1/3 of thigh. It runs downwards slightly laterally and reaches the lower border of popliteus, where it terminates mainly by dividing into two divisions. One is the anterior and posterior tibial arteries. So here in this diagram you can see the anterior and posterior tibial arteries. So this is how the popliteal artery is divided into anterior tibial artery and posterior tibial artery. Okay. So now let us learn the relations of the popliteal artery, like what are the structures which are related to the popliteal artery. So mainly the popliteal artery is the deepest structure in the popliteal fossa, and it has following relations. Anteriorly it is deep to the artery, anterior or deep to the artery. From above downwards there are popliteal surface, and especially there is popliteal surface of femur bone, and next there is the back of knee joint, yes, and next there is the fascia which is covering the popliteal muscle. So from above downwards the three structures are: first lower part of femur popliteal surface, next the knee joint on the posterior side, and next the popliteal fascia which is covering the muscles on the popliteal surface. Okay, so these are the anterior or deep to the artery relations which are from above downwards. Okay, now we will go to the posterior or superficially. So posterior or superficially, the artery is mainly related to popliteal vein. So here in this diagram we can check out that here you can see this is the popliteal artery, this is the popliteal vein. So what they are saying, posteriorly or superficially, so the artery is related to the popliteal vein, and further posterior to the tibial nerve which is separated from artery. So if you see more posterior from the popliteal artery, there is a tibial nerve, right? So the popliteal vein and the tibial nerve, if you see the popliteal vein and the tibial nerve, popliteal vein and tibial nerve, they cross the artery from lateral to medial side. If you see, this is a medial side, this is lateral side. So the popliteal vein and the tibial nerve, they are crossing the artery from first lateral side to the medial side, right? Because now the popliteal artery has come medial to the tibial nerve and the popliteal vein. At the upper end of the artery, these structures are lateral to artery. If you see this tibial nerve and popliteal vein, they are lateral to the popliteal artery at the upper end. But when we see the same structures at the lower end, these both structures, that is the tibial nerve and the popliteal vein, they become they become medial to the artery. Yes, so this is the medial side, right? This is the lateral side. So if you see that at the upper end, both the popliteal vein and the tibial nerve, they are lateral to the popliteal artery. But in the lower end, if you see, this tibial nerve and the popliteal vein both are medial to the artery now. Okay, so this is the relations, this is the posterior relation of the popliteal artery. So before we have discussed the anterior relation, in the anterior relation we have discussed the femoral popliteal surface, back of knee joint, and we have discussed the popliteal fascia, and in the posterior relation we are discussing that the tibial nerve and the popliteal vein are first, they are lateral to the popliteal artery, but at the lower end they both will become medial to the popliteal artery. Okay, so now we will discuss about the popliteal artery, by which muscles it is overlapped. So for that we need to see this diagram. So in this diagram we can check out that the popliteal artery is overlapped by muscles which are forming the medial margin of popliteal fossa. So if you remember the medial muscles of popliteal fossa, as we discussed before, that is the biceps femoris, which is coming from the femur above, and from below you have the medial head of gastrocnemius, and from from the medial side means on the above you'll have the semitendinous and semimembranous, and on the lower side you'll have the medial head of gastrocnemius. So in this diagram you can see that one, that above you have semitendinous, semimembranous, and from below you'll get the medial head of gastrocnemius. So these are forming the medial side of the popliteal fossa. So here you can see the relations of popliteal artery. It is mainly overlapped by muscles forming the medial margin. So in the foot, now you can see this is the medial side, this is the lateral side, right? Oh sorry, this is the medial side. It's mentioned here, medial head of gastrocnemius head. So this will be the medial side and this will be the lateral side. So now we'll check the what are the muscles which are around it. So mainly these are semimembranous muscle over the upper part. In the upper part you will have the semimembranous muscle. You can check out this diagram. So in the upper part mainly we have the semimembranous muscle on the medial side and on the medial head of gastrocnemius over the lower part, right? And the artery is also covered by skin and also fascia. So this is the medial relations of the popliteal artery. Of course we already discussed before the contents of popliteal fossa are nothing but the popliteal vein, popliteal artery, tibial nerve, common peroneal nerve, right? So the relations, the medial relations of popliteal artery are of course on the upper side semitendinous, semimembranous. On the lower side we'll have the medial head of gastrocnemius muscle. So in this diagram now we can see the lateral relations. So till now we discussed about medial relations. So the lateral relations of the popliteal artery are on the upper side you'll have the biceps femoris, right? And also you will have the tibial nerve, popliteal vein on the lateral side. We'll see another diagram. So this diagram is perfect. Here you can check out laterally this is the popliteal artery. So lateral to it of course you have popliteal vein, you have the tibial nerve, you have the biceps femoris muscle, right? And also of course the lateral condyle of femur, and there will be the lower part of artery which is related to plantaris muscle. Yeah, of course plantaris muscle will be in the lower side here. So plantaris muscle also related to the lower side, and also lateral head of gastrocnemius muscle on the lateral side. So now coming to the medial side, medially on the upper part of artery it is related to of course the semimembranous and also the semitendinous and medial condyle of femur, whereas the lower part of artery is related to the tibial nerve, right? So if you observe that the tibial nerve is in the upper part lateral to the artery, but in the lower part the tibial nerve becomes medial to the artery, right? And medially you will also find the popliteal vein and also the medial head of gastrocnemius muscle. So these are the different relations of popliteal artery. Now we will discuss the different branches of popliteal artery. So actually this is having several large muscular branches. The upper 2 or 3 muscular branches mainly supply the adductor magnus muscle. So upper there are 2 or 3 branches which are supplying adductor magnus and hamstring muscles because they are the posterior compartment muscles, and also they terminate by anastomosing with 4th perforating artery. So the anastomose with the 4th perforating artery, I will show the different arteries, okay? And the lower muscular or sural branches. The lower side you will have the muscular or sural branches which mainly supply the gastrocnemius muscle and also soleus and plantaris muscle. Actually the lower, you can remember this lower muscles on backside as GPS, that is gastrocnemius, plantaris, soleus, okay? So now coming to the cutaneous, I will show this muscular branches by means of diagram. So actually there is no particular diagram. Let us continue with cutaneous branches. The cutaneous branches mainly arise directly from the popliteal artery. You can see this is a popliteal artery. So from this they may directly arise or indirectly arise from its muscular branches. So one cutaneous branch usually accompanies the small saphenous vein, okay? Remember that the small saphenous vein is always accompanied by one cutaneous branch of the popliteal artery. Now coming to the genicular branches, actually there are 5 genicular branches, okay? Total we have 5 genicular branches, that are 2 superior, 2 inferior, 1 middle. What are those? Let us see. The middle genicular artery, you can see here it's mentioned this is the middle genicular artery, okay, and which mainly pierces the oblique popliteal ligament of knee and supplies the cruciate ligaments and also the synovial membrane of knee joint. So this is a middle genicular artery which is supplying the cruciate ligaments and also the piercing the oblique popliteal ligament of knee and it is also supplying the synovial membrane of the knee joint. And next you have the medial and lateral superior genicular arteries. So you can see this is a lateral superior genicular artery, this is a medial superior genicular artery. So they are winding around the corresponding side of femur immediately above the corresponding condyle and pass deep to hamstring. So for example, if lateral superior genicular artery, then it will pass on the lateral condyle. If medial superior genicular artery, then it will pass around the medial condyle of the femur bone. So like this, they will cross along this bones, and they mainly pass deep to the hamstring muscle and supply them. Now coming to the medial uh, and lateral inferior genicular arteries. So medial inferior genicular artery, lateral inferior genicular artery, they are winding around corresponding tibial condyles and pass deep to collateral ligaments of knee. So all these arteries reach the front of the knee and take part in forming anastomosis around the knee. So you can see like this, they are forming anastomosis around the knee. So this is a course of genicular branches of popliteal artery. So actually there are also some variations, like the popliteal artery may divide into terminal branches above the level of popliteus. Then the anterior tibial artery descend deep or anterior to popliteus. As you know already that this popliteal artery will divide into anterior tibial artery and posterior tibial artery at the right side of popliteus, but sometimes they may divide just above the level of popliteus, and then the anterior tibial artery then descends more deep or anterior to the popliteus. Next, it may also divide into anterior tibial and peroneal arteries. So you can see here, this is peroneal arteries, right, and this is anterior tibial artery. Sometimes the posterior tibial artery may not completely form or may be completely rudimentary. That is, the popliteal artery may only divide into anterior tibial artery and peroneal artery, but no posterior tibial artery. And sometimes the popliteal artery may divide into three branches, that is anterior, posterior and peroneal. So sometimes three may be present, sometimes only this two may be present, and sometimes this division may be somewhere higher. So these are all the different variations. Now we'll discuss about the clinical anatomy related to that. So mainly blood pressure in the lower limb is recorded in the popliteal artery, and in coarctation of aorta, the popliteal pressure is lower than the brachial pressure. So whenever there is any coarctation of aorta, that is aorta is blocked, then if you check the popliteal pressure, it will be lower when compared with the brachial pressure. That is, the pressure of blood when you take on the brachial artery, that would be higher when compared with the popliteal artery pressure. Next, constant pulsation of the popliteal artery against the unyielding tendon of adductor magnus may cause changes in the vessel wall and lead to narrowing or occlusion of artery. Sudden occlusion of artery may cause gangrene up to the knee, but this usually is prevented by the collateral circulation. Okay, so because of collateral circulation, there would be no such damage to the knee through the profunda femoris artery. Sexually, profunda femoris artery will give the collateral circulation. Next, coming to popliteal artery is fixed to the capsule of knee joint by fibrous band present just above the femoral condyles. So this may be a source of continuous traction or stretching on artery, causing primary thrombosis of artery in young subjects. So in young people, as this is fixed to this femur bone, if there is any problem to the femur bone or any knee joint problems, then it will affect the popliteal artery. Next, coming to popliteal artery is mainly affected by atherosclerosis, that is cholesterol blocks or any blocks. The lower part of artery usually remains patent when grafts can be tied. So upper part may be always atherosclerosis, but the lower part may be normal. Next, coming to the popliteal artery is more prone to aneurysm than many other arteries of body. So aneurysm, more chances of aneurysm can be seen in popliteal artery. So this is a clinical anatomy related to popliteal artery. So next we'll discuss about the popliteal vein. If you remember, in our popliteal fossa only we'll have the popliteal vein, right? So we'll discuss now about the popliteal vein. So actually this popliteal vein begins at the lower border of popliteus by the union of veins which are accompanying the anterior and posterior tibial arteries. Okay, and it's medial to the popliteal artery. You can see it's medial to the popliteal artery, and especially it begins by union of veins accompanying the anterior and posterior tibial arteries. It is medial to popliteal artery in lower part of fossa, and it is posterior to the artery in middle. I will show the diagram again. See the popliteal vein. In the upper part it is posterior lateral, right? It is posterior lateral to the popliteal artery. In the middle part, if you see, the popliteal vein is only superior or anterior to the popliteal artery, but in the lower part, if you see, the popliteal vein is medial to the popliteal artery, right? So actually this popliteal vein continues as the femoral vein. Okay, so you can see here a popliteal vein, right? The popliteal vein continue as a femoral vein at the opening of adductor magnus, right? When it goes above the adductor magnus, it is called as femoral vein, right? You can clearly observe in this diagram the popliteal vein above is continuous as the femoral vein, you can see, right? And mainly this popliteal vein gets the tributaries from the small saphenous vein. You can see small saphenous vein go into the popliteal vein, and also the veins which are corresponding to the branches of popliteal artery. So actually this popliteal artery veins will also come and drain here, and they finally drain into the femoral vein, and this femoral vein will finally drain into the iliac vein here, right? So this is all about the popliteal artery, its branches, and popliteal vein. In the next video we will discuss in brief about the tibial nerve.